Hi everyone, this video is about hyperhidrosis, but we're going to go back to the start and see what is the purpose of sweating. Sweating is an essential bodily function, and as annoying as sweat is, it's only 99% water with a few dissolved amino acids and salts in there, so it is essential for temperature regulation. This is the primary function of the sweat. Hot weather, exercise, illness causing a fever. The sweat glands release water onto the surface of the skin, and as it evaporates, it cools the body. Not releasing this heat is dangerous, as you can imagine. Its purpose is also to excrete drugs and toxins. Many drugs that are ingested are eliminated by the sweat glands, such as opiates, barbiturates, and alcohol. Also, heavy metals and toxins are eliminated in this way. Sweating is also a way in which the body gets rid of bacteria. The glycoproteins in sweat can bind to bacteria, removing them from the body. The good thing, I hope you can agree. And I just want to quickly mention the two types of sweat glands. We have eccrine sweat glands, which are controlled by the sympathetic nervous system. They're distributed almost all over the entire body, highest density being in the palms and the soles. And then we have the hyperhidrosis sweat glands, which are usually associated with hair follicles. They're concentrated in the underarm area and genitals and can be activated by emotional stress. First, stimulated by the hormonal changes in puberty, they are not significant in cooling the skin. So why are they there? Let's get rid of them. So what actually is hyperhidrosis? It just means excessive sweating. The opposite can also be true, and is called armpit. This can cause life-threatening overheating. So back to hyperhidrosis. It can be defined in a few different ways, so I'll quickly cover them. It's classified by location, either focal or generalized, and by presence of underlying cause, so primary or secondary. Let's start with primary focal. There's no underlying cause, but it can run in families. Secondary focal tends to affect a specific area of the body, but is caused by an underlying condition. Secondary generalized, the entire skin surface is affected, but usually have an underlying cause, like a medical reason. And also, you can just have nocturnal symptoms, which is associated with sleep disorders like sleep apnea, restless leg syndrome, and menopause or night sweats. Just a bit more detail on the cause then. Primary focal is usually family history, but the cause is usually unknown. May be associated with excessive sympathetic activity, example emotional and environmental triggers. Then secondary generalized, this is where the excessive sweating is a symptom of an underlying condition. You could have endocrine disorders and metabolic, such as hyperthyroidism, diabetes, the obesity and gout. We have neurological conditions such as Parkinson's and epilepsy. Also, infections can cause excessive sweating, like acute and chronic viruses and bacterial infections such as TB, HIV, and malaria. Anxiety and stress can be a huge cause of hyperhidrosis, and as comes some drugs such as antidepressants like SSRIs and tricyclic antidepressants, some beta blockers such as propranolol, and opiates. Drug or alcohol misuse or withdrawal can cause heavy sweating as well, as can cardiovascular issues such as heart failure. But these systemic conditions like cancer, rheumatoid arthritis can be an issue, and as mentioned earlier with the night sweat, menopause can bad that night with those sweats. Let's quickly touch on diagnosis. We would go through the patient history, such as onset, duration, severity. What would be the potential triggers? You'll be asked about effect on quality of life and daily activities. An examination will be needed to assess the extent and distribution of the issue. And sweat tests can be carried out as well. And the starch iodine test, where a solution is applied to sweaty areas and which highlights the worst affected areas. Thermoregulatory sweat tests as well. This uses a colour changing powder. Tests for underlying conditions such as blood, urine, as well as other symptoms that could signify an underlying condition like weight loss, palpitations, etc. This will all be investigated as well. Now on to treatments. Firstly, let's identify the cause and triggers. The GP should help with this, and appropriate tests will be conducted, but it's helpful to know what makes it worse for you, such as heat, exercise, stress, certain foods such as spicy, sweet, smoking, alcohol. Try and keep a diary and manage these as best as possible first. Next, look at the type of clothing and materials you'd wear, including underwear. Natural fibres are best, such as cotton, linen, hemp, wool, silk, and bamboo. They're breathable, comfortable, and sustainable, but some may show sweat more easily than others, like silk. Also, you can get sweat or moisture-wicking fabrics. Also good for underwear and socks, but remember to change them frequently. Also, be careful of the colours you choose. It's best, especially for armpit issues, to choose black. Blue is considered a bad choice, I'm not sure why. Alternate your footwear if possible, and wear leather if you can, avoiding boots and sport shoes. Unless you have multiple pairs, you can allow them to dry out in between wears. And there are underarm pads you can actually buy to absorb moisture and protect your clothing as well. Next, we'll leave on to actually using products on the skin. An antiperspirant is a must, not a deodorant. A deodorant will not stop sweating. Sorry, I should just mention OTC means over the counter, just things you can buy on prescription. If an antiperspirant's not doing its job, next I would move on to a product that contains aluminium salts. At least 20% is recommended, and it's available as a spray or a roll-on over the counter. It can be used on the armpits, hands, feet, anywhere really, but just be aware it can sting. The aluminium ions dissolve in the sweat and create a temporary plug to block sweat output. It does not affect sweat secretion, so you won't sweat more elsewhere to compensate, don't worry. The effect of these products wear off after a few days. They are best applied at night to dry skin and wash off in the morning. Apply every 1 to 2 days as tolerated. They can sting a bit and cause some inflammation, especially at first. You can step down treatment or use a moisturizer or a mild steroid free if appropriate until it settles down. You may only eventually need to use it every few weeks or so. Some examples are anhydrol and Dryplor. And just a note on the use of aluminium products and breast cancer. This is a myth that has been debunked. It's very safe to use. Check out cancer.gov, which has a section on this topic. If this isn't helping, the next step will be to try a prescription-only product. Here with them. Glycopyrronium, or icopyrrolate as it's also known, is an anticholinergic drug which can be used topically. I think you can get it as a wine. We next have oral medications. These are mostly anticholinergics, or also known as antimuscarinic, which reduce the activity of the parasympathetic nervous system. The parasympathetic is the rest and digest system, and when this is blocked, we have effects such as dry mouth, blurred vision, difficulty urinating, tachycardia, which is a fast heart rate, constipation, and confusion. So, although your skin will be nice and dry, and so will your mouth and your eyeballs, and there are other side effects to contend with as well, but you may feel this is worth it for you. The examples are oxybutynin and propanthenol bromide. Modified release preparations of these products may make side effects more tolerable, but they are generally more expensive. Let's look at some different approaches now. If you feel like medication isn't for you or nothing so far is working, we have iontophoresis. This is a method of inhibiting the sweat glands by casting charged ions through warm water using an electrical current, which is very mild. It's impractical for the axilla or armpits just because you cannot be submerging that area in the water, so it's mainly used for hands and feet. Maintenance treatment is needed, it's not permanent, at least monthly, and it can be quite costly. Botox. This is a high cost option that should only need repeating every 6 to 9 months. The botulinum A toxin inhibits acetylcholine release, which is an antimuscarinic action, as the medications I've just mentioned do as well. It works where it's injected, such as armpits and also palms and soles. Treatment can be quite painful, as many injections can sometimes be required. It can cause muscular problems as the muscle is inhibited, but most people don't notice this. Microwave therapy. They don't put any part of you in a microwave. I just couldn't find an appropriate picture. This is the only permanent option that doesn't involve surgery. It's safe and effective. It uses electromagnetic energy delivered by a handpiece. The energy delivered eliminates the sweat glands. They do not grow back. The treatment can be quite costly. Lastly, surgery. This is an absolute last resort, not commonly carried out due to the risks. Sweat glands may be removed surgically or a laser used for armpit sweating, or the nerves that run down the spinal cord may be cut, which controls the sweat glands in the hands or palms. For palm sweating, this is called ETS, or endoscopic thoracic sympathectomy. Complications may be compensatory sweating elsewhere, such as chest or groin, or debilitating effects such as extreme hypertension, arrhythmias, and heat intolerance. But what if you don't want to use these treatments, or have to tolerate the side effects of oral medication? I have some of the things for you to try, but evidence for their efficacy is lacking. One reason thought to be a contributing factor to excessive sweating is vitamin B1 deficiency. This can cause us to be oversensitive to stressful situations and can cause an increase in anxiety. Also, a deficiency in magnesium and calcium can contribute to excessive sweating. So it's worth increasing your intake of these vitamins if you can first. Sage, 1,000 milligrams twice a day as a dry capsule, or drink 1 litre of sage tea, or soak hands in feet for 20 minutes daily in a sage solution. It can be used for sweating or hot flushes, used for at least 8 weeks before assessing the benefits. It's rich in vitamin B1 and has a long history of use for this purpose. Other modalities thought to work are acupuncture and hypnosis. I'm not sure how effective these are, you have to do your own research.